record here and we'll pull up the study guide. Any questions before we start? It's going to be 50 questions like normal. We're going to have the 5 math, so make sure you're ready for the math. What else? Any other questions before we start? Okay, just pulling up your study guide. If you have your study guides, I'd pull them out, and that way you can highlight as we go over them. Just pulling that up for you guys. Hold on. I'll share this. My computer's slow this morning. All right, let's just pull up the, we're going to start on the PowerPoint. We'll go over it. It correlates with the study guide. I'm trying to pull the study guide up as well, but my computer's kind of slow for right now. So let's take a look at those initially. It's going to cover all the chapters we've covered since last quarter, since last exam, sorry. So anything that we've gone over, you guys should have up and ready to go. All right, so on our PowerPoint, I'm going to share with you guys now. Alrighty, so on our PowerPoint, we've looked at our first set of concepts, which is going to be health disparities by social and economic concepts. So if we look at that, we're going to see that we have it through economic stability. We look at our environment, education, food, community and safety, and the healthcare system. So all of those things are going to have an impact. And I spoke in my class, and you guys should think the way to think about this is how are we going to see if you have low financial situation, you're going to have an impact on everything. So you're going to have an impact on what kind of housing you can buy, where you get your education. What we know about poverty is we see an increase in
Hey, Professor Alani, your microphone is off.
We can't hear you.
Hey, Professor, yeah, you're muted.
We can't hear you.
Sorry, guys, I was muted. Did you hear anything I said?
No.
No.
Slides. Okay, let me go back a little bit. We were going to do the study guide, but what I think I'm going to do is do the PowerPoint initially, just to go over it. So we talked about health and poverty, and what we say about health and poverty is that when you have low income or you don't have a lot of money coming in, you know that that's going to have an impact on our morbidity or mortality, our life expectancy, our functional limitations, our housing, our education, our food, community, and our health. Stephanie, I see your hand up. Do you have a question? No. All right. And then when we look at poverty and what's our impact of poverty? So we look at the group, our highest rate are going to be kids, minority, racial, and ethnic groups, single parent families, especially those that have a woman heading it. And then we're going to know that racial minorities, Hispanic is going to be our top in our poverty section. Number with college degrees is going to remain lower in our rural areas. So what is that going to do to unemployment? Anybody know? What do you think that's going to do to unemployment?
It's high. It limits their job opportunities.
Can I not hear you? Wondering. Anybody?
Hello, testing.
It's going to become higher.
Because I'm not hearing anything from anyone. Can you guys hear me?
Yes.
But we've been talking.
Okay. All right. I guess nobody wants to say anything today. That's fine. So for unemployment, we're going to see an impact there. Unemployment will be increased of course, because we don't have that education going on there. When we look at our migrant workers, what our major thing we're going to think about is our pesticides. They're around them all the time. Know that we see an increase in our health status when we look at urban clients. Why is that? They don't engage in preventative health screenings as much. We see more chronic diseases. We see health issues as a challenge reporting them. In our rural communities, we see some issues that may be occurring, and that would be decrease in travel distance as well as availability. So we have lower in our resources. Like we said, we have an overall decrease in health status because they're less likely to do activities during their leisurely time. We're going to see a decrease in compliance when we look at safety precautions such as seatbelts. With our migrant workers, what else are we going to worry about? We already talked about our health concerns is going to be our pesticides. What do we know about communication? Maybe sometimes they are not able to communicate effectively. So something we need to look at. We have our secondary prevention, and with our pesticides, we're going to be looking at our management as well. Oh, you were talking, but you couldn't hear. I couldn't hear you. That's weird. Hold on a minute. Let me see if something's. Thanks for letting me know. Let me stop sharing. See if it's mine. Oh, that would be why. My volume's muted. Okay, sorry about that, guys. I can hear you now if you talk. All right, we're gonna go back to our PowerPoint here. All right, so we look at that. So primary, secondary, tertiary. Anybody want to come up with a primary for pesticides?
Education on hand washing,
Awesome.
protection gear.
Yeah, you're gonna hand washing, you're gonna have hand washing stations up, right? So that they have easy access to them. Good. How about secondary?
Screenings for eating kind of symptoms for gas poisoning.
Yeah, and then we'll have our tertiary. We're gonna have our management once they're actually exposed, right? Okay, so migrant, let's see. Know that in our migrant population community is going to be a big barrier. Some things we look at is that they may be using like herbal medications. They may use like, religious rituals, spiritual cleanings, things like that. So maybe just be real sensitive to our bias towards that and be aware that they may be taking something, a vitamin or something alternative medicine that might be impacting them as well. We move a little bit on to our vulnerable populations, and what I had told my class is like it's like a group. We looking at these different groups that all have something like our vulnerable populations are going to be susceptible to other things. We know our migrant workers are going to be susceptible. So just when you're thinking about it across the spectrum, these are different groups we see in our community that are all going to have some things that are holding them back. So no, in our vulnerable populations, we're going to see the economically disadvantaged. We're going to see ethnic minorities, low-income households, elderly, homeless, things like that. Okay. Homelessness, we talked about in my class, and we'll look at these pictures here. I think the pictures tell a lot. We see families with children as our fastest growing population. We know single motherhood is increasing in our homeless. We know that a lack of education and poverty is a problem. And poor teens are 3 times more likely to drop out. So when you think about this, it all kind of makes sense, right? We're not having employment. Our employment is down. So we're going to see families with children having an increase in our homeless population. Single motherhood is increasing. Why do you think that may be?
Lack of education.
Mm-hmm. What else do we know about the homeless teens?
They're risk takers.
Good. Yep. They're more likely to take risks. They're going to be have a higher rate of exposure to STDs, right? So when you
They
think
have a
about
lack
that,
of financial stability.
mm-hmm, yeah, and all our homeless are going to lack that, right? So, but particularly the teens, because they really are just suffering so much. So if we have a pregnant teen, we talk about this just a little bit with the homeless. You want to make sure you try to keep them in school as much as you can, and that just allows people, allows you to keep an eye on them, kind of, and help out. We look at single motherhood. Again, poor teens 3 times more likely to drop out of school. Why do you think that may be?
No support.
They have to get jobs.
They have to find a place for the kids, right? Some schools have in-house daycare, but some don't as well. We look at mental health as well, because this kind of goes with our vulnerable population and our mental health, mentally ill. So we're going to look at community health providers and know that we're going to do activities and things. This is all primary prevention we're going to do with mental health. Provide activities to school age kids. We're going to have them learn to think and act, help families with coping skills. We go a little bit back to the homeless and healthcare. We know this. They're not, where are they going to get their healthcare from?
Emergency department.
Yep. You're going to see anybody works in the ER sees them. Why they do that is because they don't know where else to go. They don't have, primary care. And so they go there, and then, the cost of providing care for the homeless is very expensive, but nothing is covered. So a lot of clinics won't take them because they don't have any money to pay for anything. And when we look at Healthy People 2020, and we're going to look at substance abuse, again, this is part of our vulnerable population. We're going to look and make sure that we're trying to increase the proportion of teens that are not going to use substances. We're going to reduce our initiation of tobacco use and reduce the proportion of non-smokers exposed to secondhand smoke. So I will tell you, and as in your first test, you're going to have some questions about Healthy People 2020 objectives. If I were you, this is one that I would know. Things with substance abuse. Any questions on that? All right. Here's when we look at how we can do some prevention with substance abuse. We do our primary, our secondary, and our tertiary. We're going to prevent the use of the substance. Secondary, we're going to screen and detect or reduce our substance use. And then tertiary, we're going to work to fix the harm. So what's a tertiary prevention you would think for substance abuse?
Nicotine patch.
What'd you say?
Nicotine patch.
Okay, yeah, that's one. There's one that I told my class, and when you see tertiary, this is a popular thing to do during tertiary prevention.
AA meetings.
Yeah, exactly. Very good. Support groups. You're going to see support groups for all this kind of stuff. And that's going to be, people who already have it, and they all meet together and talk about ways to get through it. Does that make sense?
Yes.
Alrighty. What do we know about vaping? What I want you guys to know about vaping. I told my class, be very careful. If somebody says I vape, it doesn't do anything. We know that it does. And we know that the oils can be toxic to children. So if you have a patient who's vaping and has a child, make sure you teach them about the oils being toxic. Okay, we look a little bit about parish nursing, and for parish nursing, I just want you guys to really know the 2 different types. We have the congregation-based and we have the institutional-based. Does anybody remember the difference between the 2?
Institution is a building associated with the religion, but not connected.
All right, so this sort of, this hospice nurse is going to go out to the community, get other people involved. Congregational is just going to be worried about the congregation as a whole, not necessarily branching out, right?
It is institutional, like partner with different, other, different places to provide different services that the congregation doesn't.
Yeah. So, and the way I taught my class, this to remember it is think of institution as like a big thing. And so you have a lot of different pieces in there, right? And then congregation is just one individual community. So that's just a way to remember the 2 different words. We know that we're going to see our faith nurse act as a case manager. Different levels of prevention we'll see are going to be looking at our weight and our nutrition among our congregation. And so we're going to see the proportion of places that offer nutrition or weight management. We can reduce the proportion of children and adolescents who are considered obese. We can help do education, prevent inappropriate weight gain, and increase our contribution of fruits when we're looking at that.
No.
Our key here is going to be with our faith, and hospice nursing, that we do therapeutic communication, make sure safe and effective. And we know as our hospice nurse, our key is going to be maintaining dignity and comfort, right? Okay, that's the end of our second slide. Let me pull up our first slide, our first set of slides. There we go. Alrighty. Let me share with you guys. So we're going to look a little bit about case management and how that impacts us. Know that for all of your any of your questions that come up, and you saw some of these on your first exam, you're going to use your ADPI to make decisions. So when we're looking at gathering our history, we're going to look at our assessment phase. So I want you guys to remember that we're using our nursing process here, and we're going to know that we're going to steer the conversation towards goals to make sure that we get our outcomes that we want. Hold on, I have to add these. We then are going to look at the relationship between Medicare and Medicaid, and I do want you guys to know the difference. So on our Medicare coverage, we're going to know that the client has to show the need for skilled nursing care. So for example, things such as like sitting and assistance with like activities of daily life are not going to be covered by Medicare, but we'll see things like being able to provide wound care is something Medicare will cover, because you really need a nurse to do that. And so know that with Medicare, they're real particular about what they'll cover, but they will cover any nursing services. When we look at Medicare versus Medicaid, we know that Medicare is for over 65. It has hospital services, it has prescription services. We have low premiums, and we have a different enrollment. Medicaid is going to be for our low-income families. It does the same. It's going to do hospital services, physicians, x-rays, home health. There's no cost, depending on, they look at your overall income, and you can get it at any time. So if you qualify at that point. One thing we looked at and talked about was our home environmental health, things we look for in our home: safety, radon, carbon dioxide, mold. What are we going to be worried about with kids?
Chemical.
Lead.
Yep, good. Lead, our medication storage. Lead, you're going to watch the walls and do, baby proofing, things like that when we're in somebody's home environment. Any questions about home health? I know for my class, I was out sick for this week, but Dr. Lundy was kind enough to share her lecture on it and a video about it. Any questions on that one? You just want to really be assessing the home environment. What can you do for safety? Things like that. Watch for, toiletries they don't need, a safety bar if they need some help. Watch those floor mats, right? Okay, the next section we're going to do is epidemiology, and we're just touching on it for this exam, and we will go into it further in the next couple chapters. Just so that we know, epidemiology is going to be our study of the distribution and factors. So how do things go about and what contributes to our health related states or events in a population? What do we do with this? What do we do with the study of how is it coming, or who's getting it, or what are the factors involved? We look at it and we do an analytic look at it, and we're going to look at the causes and decide what's determining it. And that's going to be our analytic epidemiology. Some questions we might answer is, how is this occurring? Why are some people affected more than others? Okay, and our data definitions, these are definitions I just want you to know for the exam. Our case fatality rate is going to be our proportion of people diagnosed with a particular disorder. who die within a certain period. So think about the words case, fatality, and rate. So it's case is people, fatality is die, and then rate is within a period. So that's how you can remember that one. Those three keywords: people, die, and period. Okay, so it's considered an estimate of the risk for death within that period for somebody who's newly diagnosed with it. And then people diagnosed with a particular disease, oftentimes they'll say like, what's my chances, right? So that's going to be your case fatality rate. And this overlaps with our epidemiology because we're looking at the factors and what's happening with different disease processes. Any questions on that one? That's just a definition I want you to know. There we go, a little bit to environmental. Occupational health is something that you guys covered this past week. What is the occupational nurse going to look for in the environment? What does the health nurse look for in the employees? What do you think the occupational health nurse, and if you work in a hospital, I'm sure you've worked with them, but what do they look for?
Safety or imminent danger.
What else are they going to look for?
Proper use of PPE gear, equipment.
Yep, good. What else? What is the first thing they have you come in for when you're starting in a hospital?
Vaccines.
So they want to make sure that you're healthy and you're covered and you're getting your preventative care, right? They're going to make sure things in your workforce are going to be safe. There's nothing there exposing you to anything. Any questions on that one? Occupational health. That's just a quick little. You might see some questions like the occupational health nurse may do this, this, and this, and it's just really they're looking for the safety and well-being of those people that are there with them in the work environment. Let me see what else. Yeah. All right. We're going to look at two different types of studies here. One is going to be our ecologic. It's going to be our most inexpensive type of study. What we do with these ecological is we're going to just look at things that we know, such as like population rates. And it's going to be pretty basic. And we're just going to look and see, can we create hypotheses or find things based just on simple information that we know about a population. And then when we look at cross-sectional, we're going to look a little deeper. So you cross over different sections. So you're going to look at where are we seeing in a population or a group? Where are we going to be seeing disease process or exposure? What are some risk factors? We're going to see a lot of information covered in the cross-sectional study, not just looking at the basic like population rate and things like that. Right. So our cross-sectional is going to be much deeper than our first one. And then we have a retrospective, which is going to be, we look on things that have happened already, and we use that to find some studies. And so we find over time what has happened, like who's been exposed, where did they live, those kind of things. And then we're gonna determine what that causes. So this sort of goes with our epidemiology a little bit. These are a little out of rack, because I don't know. We all shared these PowerPoints, but I was just looking. All right, so I think environment I'm fine with. Occupational hazards, we talked about this. Safety, really. So we'll look at all these different kinds of hazards. We could have physical, chemical, biological, mechanical, are the machines working, psychosocial, something going on in the environment. Those are the kind of things you look at with the occupational nursing. All right, and that brings us to the end of our PowerPoint. I feel like I went over that pretty quickly. Are there any questions about the study guide or any of the topics you want me to cover? For your study guide, I will tell you, it's pretty much know everything that's on there. That's how, the exams are written with that.
What did you say the function of the OSHA was under occupational health nursing?
I didn't go over that. I skipped over that. That's on your study guide, I believe. I can pull it up real quick if you want, Marla.
Is there any way we can get that PowerPoint?
Unfortunately, they don't let us share them because they want you guys to go to the review sessions, and then we, based on the review session, we go through it. Here, Marla, here's your OSHA. It's going to create and regulate, enforce regulations. Know that our National Institute for Occupational Safety and Health is exactly what it says. It's going to do research and education. So no, on this one, I didn't go over much of this, but this is just definitional, really. That's what we want you to know on that. What's OSHA and what's National Institute for Occupational Safety and Healthy. Any other questions on that one? I'm gonna highlight everybody. Chat. Let me pull up our study guide and we'll look at that real quickly. If my computer will cooperate. There we go. I have mine from, I don't think it has changed much. So I want everybody to pull up their study guide and take a look with me. And let's see if we have the same one. I'm going to share my screen. Is this how your guys looks? Page 2?
Yes.
Okay. So we'll look at this. We talked about poverty in rural areas. We know our highest rates. We know education. We talked about that. Physical demands of harvesting crops. What is that going to do for our musculoskeletal system?
Gonna be harsh on it. Bad posture.
Yep. What are we going to see with that? What kind of pain?
Back.
Lower back pain.
Mhm. Okay, hold on. I'm sorry. Another professor's asking me something. Okay, we're gonna look at our health risks, which we saw those pictures. We talked about this, our health risks. They're gonna have a decrease in health status in our migrant population, in our rural communities. Because why? Because they don't get those health screenings. They don't participate in those activities that are gonna keep them as healthy. Know that our communication in these rural communities, the people are usually very familiar with each other. Think about one of the students in my class is in a rural community, and she was sharing, you get to know everyone, you know, everybody's family and everything, because just, you know, it's not like living in a city where you don't know who's in your apartment complex, you know. So these people are going to know each other. Lack of reporting with abuse and things like that is going to be important. Primary teaching and tertiary teaching, we talked about pesticides. So primary is going to be provide education. Hand washing stations we talked about. And then our tertiary is going to be looking for things such as nausea, vomiting, and skin irritation, because this is all going to come into play when we have that. Okay. And I don't think this one, do you guys have this about the cultural considerations regarding Mexican culture?
Yes.
Okay. What I want you to know about that one is that they, the Mexican community, they do like to, like chit chat before they have any other, you know, like they'll talk about little things before you get into health. So when you're dealing with them, and know that touching they feel like is something that is good, not bad. And then our vulnerable populations, we talked about this. This was not on our slides, but it's something you guys should know at this point, I would think, but just know our HIV and how that's transmitted. We see high risk for those who use IV, multiple sex partners, and our adolescents. And they're, you know, we're going to see those adolescents, the homeless adolescents, be at higher risk for substance abuse and things like that. We talked about single motherhood is increasing among our poverty and our homeless. Poor teens are 3 more times likely to drop out of school. What I really want you to know is when you're looking at that homeless population, you're going to know that they're going to have some things coming at them that other people may not, right? It's going to be hard for them to do education. It's going to be hard for them to get food. It's going to be hard for them for lots of different things. So that's why we have that graph on there. What kind of discharge teaching would you do with medications that depress the central nervous system with alcohol?
Don't drink on them.
avoid alcohol.
Yeah, pretty much. Don't drink if you're on one of those, okay? We talked about what community health can do. Homeless people have the same population as those in poverty. There's a real correlation there, you know, because we're all kind of suffering a little bit. Oopsie, sorry about that. Just to make sure there's nothing, okay. We talked about tobacco, what we're gonna try to do. We're gonna educate primary, secondary, and tertiary. What are some risk factors? I'm trying to think why they're asking this. No, on our risk factors, we're thinking about those oils and the vapes and things like that. Those. Okay. Here's it where it is, the vaping. That review, psychological dependence can occur with chronic use, and drugs are safer to use. I mean, what are some risk factors for vulnerable populations to have these problems? I mean, they're looking for an escape oftentimes. We talked about congregation institutional based. How do they act as a health advocate? How would you say the health nurse community, faith nurse, sorry, acts as an advocate and case manager? That was on our
Should like set up appointments for people if they need help.
sure, good. That's one way.
Activities.
Hmm?
Activities, nutrition.
So one of the Healthy People 2020 objectives, I will tell you, for community health nursing is going to be with healthy eating and reduce obesity. So we look at that. Review the nursing function of hospice nursing. We talked about providing dignity. We're going to do everything we can to have them feel as empowered as they can, sensitive to parents, you know, sensitive that these are parents possibly that of other people, so they're worried about that. So we're going to be sensitive to those kind of things. We look at our nursing care process and add PI. And so any questions on that, we kind of went over that one. No, you'll see it here again. When discussing health problems and limitations, the nurse is gathering a history as part of the assessment phase. So you've seen that twice now, so I would identify that knowing the assessment phase there. All right, for Medicare, we talked about they must demonstrate the need for skilled nursing care. And so what is skilled nursing care? We'll see that as like taking care of a wound, but things like sitting services and assistance with activities daily life, you're not going to have that covered with Medicare. Our Medicare 8 years 65 and over. Medicaid is based on lack of financial resources. Medicare will only pay for home health care served by skilled professionals. We've talked about this 3 times now. So if the question is, what will Medicare cover? What is Medicare going to cover?
Anyone over 65 that has sort of skilled nursing needs.
Yes, needs skilled professional. Good. Medicaid does not require homebound status and may reimburse for things that Medicare will not. So I don't know if anyone's had this experience, but sometimes people on Medicare will join Medicaid as well, because a lot of times, you know, these over 65 year olds, they can qualify for Medicaid because they don't have much income coming in, you know, if they don't have a retirement or things like that set up. No, our primary goal of hospice and focus of care would be providing dignity to our patients, making sure that we're watching out for any of those abuses that may occur. Hopefully that's not happening, but we talked about epidemiology. It's just our study of how we're going to look at things and how they impact and how does that create disease processes. Case fatality rate we spoke of. Healthy People 2020 objectives for environmental health. That one I don't think I focused on too much, but just know we're environmental health. We're looking to reduce our anything in the environment that's harming us, right? Role of an occupational nurse. We talked about the different types of safety. Principles of the epidemiological triangle. We did not do that one. Does anybody remember the 3 parts of that?
Agent, host, environment.
Yep. And I want you guys to know that. I want you to know that triangle and know examples of all. All right, know the definition of incidence and prevalence. Be sure to give examples. Right, so incidence is how often it's occurring, and prevalence is how often it has occurred, is pretty much what we want you to know on that one. Know the definition. Okay, we talked about the different types of studies. What is the role of the occupational nurse? Didn't we just have that? Oh no. And I want you to look at your Healthy People 2020, which we looked at for occupational health. Function of OSHA. Oh, this is why you're asking me, Marla. I forgot that it was on here. All right, so that's about our study guide. So it's a little shorter than it was last time. And we pretty much covered most of it in our review. Are there any outstanding questions out there?
Can you repeat how you worded the definitions for incidence and prevalence?
Sure, hold on. Well, incidents, I wouldn't worry about my definition of it. The reason I'll tell you is because I'm just trying to give you a quick version of it. But incidence is when, you know, how often it's occurring, and prevalence means it's occurred already. That's a way to remember it. The definition is not going to be that basic on the test, but it's a way for you to apply it. Right, hold on one second. I'm going to grab one more thing and make sure we covered everything I wanted to cover. Okay, just give me a second. Alrighty, I'm back. I just wanted to look at something. All right, so we talked a little bit about this. We'll just review some topics that I want you to know. We know that who's at a higher risk of illness following an exposure to something in the environment.
Homeless people, like a
Yep.
woman with
Homeless people and
children,
who else?
children and
male.
elderly.
Migrant workers.
Migrant workers.
Yep, we're really going to look at though, and I tried to emphasize this, but I guess I didn't do a good job. Those ones with those like chronic illnesses, you know, life-threatening illnesses like HIV or hepatitis B or something like that. Because remember, these people are going to be more exposed to that kind of stuff. Their environment is going to be probably not as clean and clear as somebody else's. So think about, you know, our homeless, and we're going to see those are going to have those illnesses like that, and then they're going to be exposed to, you know, a less healthy environment. And so what's that impact going to have? We talked about environmental health, what's important for kids in the environment. What are we going to look at for kids?
Safety.
Yeah, I want you to be very specific though. Safety to what?
Nicotine
Lid.
and oils.
Our key is going to be, I think somebody said it, not oils. No, that's when we're looking at vaping. That's not in our environment though. Remember?
Lead.
Or lead.
Secondhand smoke.
Yeah, no, lead is going to be our primary.
And how it's stored.
I'm sorry, say that again.
Education
Lead is going to be
about-
our primary with environment and kids. Okay, so make sure that you know that. That's going to be one of our Healthy People 2020 objectives as well.
I'm sorry, can you repeat that, please?
Yeah, when we're looking at kids and environmental health, what we're looking at is we are looking at lead and the exposure to lead. We want to minimize that exposure to lead on kids. You don't see it so much more. You won't see it in newer homes, but you will see this as a concern among kids. And it's a Healthy People 2020 objective for environmental health with children.
Thank you.
Mm-hmm. Let's see what else. For your different types of studies, the cross-sectional, the retrospective, and the ecological, I want you guys to figure out examples of each. Okay, so if we're looking at what has happened over a period of time in a certain environment, what kind of study would that be? Anybody? Good. It'll be our retrospective because we're looking at over a period of time in a certain community. Does that make sense to everyone? Okay, some questions that you might see about occupational health are going to be, what are we going to do to help those limit any disabilities in our occupational health setting? Marla asked me, and I did give you guys the mission, which is going to be of OSHA, which we know is really to keep our safes, our working environment safe, right? So we're going to take a look at that. I'm sorry, hold on. Alrighty. Any other questions on our topics? I'm just looking at one more set of data that I wanted to look at. Any other questions that you guys have outstanding? I think I about covered everything I want. Remember, on these tests, sometimes you'll see questions that may not be specific to may require you to use your med surge, okay, with your question thinking. So when you're doing process of elimination, we know how to do that with our airways, our breathing, our circulation. When we're looking at something and what's most important, we're always going to be thinking about that. And let me see, what else can I look at here? You guys are really quiet. Anybody have any questions out there? I appreciate your patience. Like I had said, I have been sick for over a week, so I'm just trying to get myself back into the swing of things. But I don't know if anybody's had COVID, but it's not something I would suggest. What's important when we're looking at our Mexican population? What are we going to make sure?
They like to talk and touching is good.
Mhm. So you're gonna like talk about not anything health related initially, right? Our case fatality rate, I went over that with you guys. I want you guys to make sure that you know what that definition is. You may see an example. Remember, and this is,
What was an example of, what was it again that you said?
yeah,
I
so it's
had a
like
question about, oh. no, go ahead,
case
go ahead.
is like, remember we said it's the number, fatality is death, and rate is how often. So that's the way to remember that one. So
Okay.
an example would be like if somebody got sick, they say, what's my chances, you know? Did somebody else have a question? No? Rosanna, did that cover it? I think you were asking. Yeah.
Yeah, I had a question about that, but that pretty much,
Okay,
answer my question. Thank
sure,
you.
no worries, yep. No, you're two different types of parish nursing. Know that congregational is going to be more like just working with the church, you know, by itself. And then we look at our institutional is going to be wider spread. It's going to be going out to other things. What do we know about tobacco use?
I'm sorry, I just have a question. If you can go just back just a second. You said the information we need to know about the parish nurse is that their involvement with the church.
The two types, the congregational and the institutional.
Okay,
We talked about congregational is with just the church and like they stay together with just that group. And then institutional, they're gonna like branch out and go to other places and help involve that community.
okay.
Does that make sense?
Yeah, because institutional is more going out.
Yeah, it's like involving other
congregational is
people. It's
more
not just
involved in-
congregation.
Okay,
Yeah, and that's what I want you to know. You probably, I don't know, but I mean, I do know. I can't forget it. I'm not gonna say because I don't want to give you any more information than I should. We talked about Medicare and Medicaid. Let's see what else we need to know. Our host, our agent, and our ecological triangle. I want you to know those. You're gonna see a couple questions on examples of those. You're gonna see primary, secondary, and tertiary education and prevention. Sorry, prevention. We know our primary is going to be. What word do we look for primary?
Education, preventing something.
Good. What do we look for secondary?
You're screening to make sure that they don't have the disease or symptoms for it.
Good. And our tertiary, we talked about this again. What's one of those words you're going to see with tertiary, particularly with substance abuse?
Support groups.
management.
Yep. Support
Okay.
groups. Yep. And management, you know, help management of what happens after. You're going to see support groups is going to pop up. So I briefly went over this. I did it kind of quickly, and our risk factors for alcohol abuse and drug use. What are some things you know of that I don't need to teach you? You guys know this. Who's going to be more vulnerable to use?
Teens.
Homeless teens.
Homeless
I
teens,
know.
yeah. Who else?
People
What do
that
you know
need
about
this-
addiction?
Yeah.
People with mental health issues as well.
Yep. Yep. You're going to see mental health trying to cope with mental health. And so what are they going to do? They're going to use drugs so that they can get their brain to think differently. What else? What else do we know about addiction?
It's hereditary.
Yep. So who are we going to see more likely to do that?
Kids with family history,
Yeah.
genetic.
Yeah. And remember our kids and adults that are, you know, encountering violence in any way, they're going to look for an escape as well, right? So there's quite a bunch of people that would be most vulnerable.
So with violence, would that also include sexual abuse?
Yeah, any type of violence, sure. No, it's not going to be specific, but you do know. I mean, just think about that's why you guys know this without me even having to go over it. Think about who we know is going to be vulnerable to succumb to an addiction. You know, people that are trying to cope with something people that brains are not working in a way that they are comfortable with, right? Those people that have seen parents use and abuse, and it's genetic, so they'll do the same. Doing a drug screening, what kind of prevention is that?
Secondary.
Mhm. Right, yeah, we talked about oil and vaping. There's a couple other things here, just to make sure. What's important with our pregnant teens? What do we want them to do?
Make sure they're following
Come
their
back.
care.
Stay in school.
And also come back as soon as possible, yeah.
So stay in school. So that's going to be our focus with our pregnant teens. We talked about alcohol and a CNS medication, and so we're going to make sure that we don't mix those, which you guys know, without needing to take community health, I hope. Why is healthcare for the homeless such a problem?
They can't afford
Because-
it.
Yeah, they don't have the resources. They were looking like for a queue when they, have any onset problem. And they
And so
don't attend to
good.
follow.
What's that going to do then? So they go to the ER. What's that do for everybody else?
Raises
We
the
pay
cost.
for it.
Yep, very good.
To the community.
Yep, you're going to feel that impact on the community because somebody's got to pay for it, right? All right, that about covers it. Homeless, I will tell you, homeless teens, you're going to see 3 or 4 questions on that. So we about covered. We want them back in school. We know they're more susceptible to everything. And we just need education for them really well. Thank you, Stephanie, by the way. Any questions? What I would do, guys, for your test is I would review these review sessions. Everybody did it a little differently. We all use the PowerPoint. That's why I was going to do just a study guide, but I did the PowerPoint and the study guide with you. So we made sure to cover everything. And try to, when you're taking the test, just try to use your common sense. Because, in nursing, sometimes we're so worried about studying the material that we forget common sense questions. And I found that across the board. So just try to remember, take a deep breath, think about what makes the most sense. Try not to get tied up. There's a couple definitions I told you to know. Case fatality rate, I want you to know. No institutional, congregational. Know why our rural community is in the situation it's in. We know with our Mexican community, we're gonna make sure we're chit-chatting with them, talking about things other than healthcare initially. I'm just trying to review in my head what I know you guys need to know. Any other questions? You guys are the quietest group I've ever had. No?
As for the math questions, are we looking at drips or something like that we need to do, or is this just regular type of math?
Math? Let me look real quick, okay? It's usually like your other math that you did last time.
Meaning no peds.
I'll tell you in a second. I thought you guys had one peds last time. You have peds on one of yours, because you have to convert. So you're gonna know, it's infusion rates for a couple of them. Like how quickly something gonna run. And then for 2 others, you're gonna have to. These maths, I think they're super easy, but you're gonna just have to the nurse has to give such and such, and this is how it comes, how the quantity comes. And just then you figure out. Say if the nurse has to give 2 mLs or 2
Like an order
milligrams.
over availability.
Yeah. Yep. But I will tell you the math, I just looked at them. They're not that difficult.
Safe dosage, is there any safe dosage questions?
Uh-uh. Nope.
Okay.
No,
I
it'll
have a
be
quick
just,
question.
yeah.
Going back to the National Institute for Occupational Safety and Health, they do research, and what was the other part that they do? Was it education or?
Yeah. I will tell you on that one, that used, uh, we want you to know OSHA and that one.
Okay.
It might be something like this organization, does blah, 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 blah. OSHA we know is trying to keep everybody safe.
Right. Okay. Thank you.
Okay, sure.
Question for you.
Yep.
For the care plans and nursing process ADPI, we just need to know, we're gonna need, let me start all over. Is there gonna be examples of like each, like for ADPI, like planning, implementing? Is that what we're talking about?
Yeah, sort of. You need to know those different processes like assessment, what you do during an assessment,
Okay,
and implementation, I think is the other one you need to know.
okay.
So yeah, you're
So if you
around,
understand, so if we understand ADPI, then we should be able to know whatever example you give us, which one falls into that category. Is that what?
well, I would hope so. I mean, that's the hope, right?
Okay, right.
Yeah, you want to know assessment, implementation, and outcome identification. Examples of all three of those. Any other questions out there, guys? You can always listen to me again. I'm sorry, my voice sounds awful, but this is like the second day that I'm able to even speak. So, but listen to the other review sessions as well, because I know all the other teachers emphasize, we all emphasize something a little different, based on what we think is most important. But I think you guys will do fine. This is your second exam. Know that if you need to meet with your teacher one-to-one, all the teachers are able to do that. And any other, questions you guys have, you can always reach out to me. I'll put my email in the chat, and I will send this recording to all of your professors as soon as we end here. So they'll be able to post it. Oops, I forgot the C in college for my email.
Hey, Professor, I have a question.
Sure.
What's the difference between ecological, cross-sectional, and retrospective cohort study designs?
Yeah, we went over that a little bit in the, remember ecological is just when you're getting like basic information. So it's not going to be not too much. The cross-sectional and the retrospective, those two are going to be, I want you to know both of those. So I'm going to show you my PowerPoint again, and I want you to write down how I defined them for you. Just know ecological is going to be your like basics. And then take a look here. Because I will tell you, you're asking me about this, you're going to need to know examples on this. So let's just look real quick. All right, so our ecological, oops, hey now. Our ecological is going to be our basic one, right? We said that. And then we look at our cross-sectional. This is when we're going to look at different people, and we're going to see in this population is, so what those that were exposed, we're going to look at those specifically, and what was true about them and what were their risk factors. Okay, and then we're going to look at those that were exposed but didn't get disease and what was theirs. Okay, and then we're going to compare the two and see cross-sectionally, looking at different parts, how we can see the scope of the problem and when is that going to occur. And then when we look at our retrospective cohorts, we're going to be looking at what has happened over time. These people have been exposed to something in a certain group. We can look at them and then we follow them over time and see, did the outcome occur? Were they all exposed? Were they not exposed? So I want you to think of retrospective in a circle. Okay, what we do is we look at the exposure and see, was there exposure? How does our outcome come? What happens over time? So those three factors we're going to look at as a circle. Does that help a little bit?
Yes, ma'am. Thank you so much.
Mhm. So on your cross-sectional, you're going to be looking at different groups and putting them together. In your retrospective, you're going to be looking at groups and what has happened over time in a certain group in a certain period. Have they all been exposed? Have they all gotten something over a certain amount of time? Does that make it a little simpler?
Yes, 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 yes.
Okay,
Thanks.
so you're going to see on retrospective, an example would be like in a workplace, over time, everyone's developed asthma. So that's going to be retrospective. You're going to look at what were they exposed to, what was the time period, that kind of thing. Okay, any other questions? All right, guys, I'm going to end it. If you have anything, please let me know. And best of luck to you guys. I'm sure you'll do fine.
Professor, I have a question. Did you take attendance already?
Yeah, I copied it out of the chat,
Okay, all right.
but let me just make sure you're on there. Hold on. Let's see here. I'll put you on there. I don't see you quickly, but tell me your first and last name. L-A-S-H-U.
LASHUN, first
Uh-huh.
name. Last name is Agnew, A-G-N-E-W.
And who's your professor?
Marvel, Professor Marvel.
All right, great. So I have either your professors or I have where you're from, which is fine. We all know who we have. So any other questions out there? I'll send
I have a
10
question real quick.
as well. Sure, go ahead.
All right. What did you say about tobacco use that we needed to focus on?
Know that it's top killer.
Okay, thank you.
Yeah. Any other questions, guys? All right, I think hopefully you guys do really well. It's multiple choice, 50 questions, 5 math. I told you the math is not too difficult. Okay, just use common sense on the math. Okay, all right, best of luck, guys. Take care.
Thank you.
Okay,
Thank you.
you're
Thank
welcome.
you.
Bye-bye.
Thanks. Feel